Sexually transmitted diseases, a term used to refer to a condition passed from person to person via sexual contact. With exceptional frame data and extremely good DPS, STDs have been inextricably rampaging our disease meta, so I wanted to make a tier list on the most overpowered STDs of our time. First up is bacterial vaginosis. This polymicrobial clinical syndrome has pretty generous frame data. Symptoms include thin white or gray vaginal discharge, pain or itching in the vajay, a strong fish-like magikarp or Phoebus-like odor. The vaginal discharge that occurs with this STD comes out in 5 or 6 frames, making it a pretty good option out of Shield. There is a bit of end lag after the vaginal discharge, so be careful because you will be vulnerable. And make sure to space out your discharge when fighting your opponent in neutral. Bacterial vaginosis is curable with prescription antibiotics. You'll usually regenerate back to health within 7 days. However, bacterial vaginosis is kind of like a permanent poison powder from a Venusaur that does residual damage over time and can come back. Experts say that follow-ups with a healthcare provider are unnecessary if symptoms resolve, so you don't have to tech chase an appointment. Bacterial vaginosis, A tier. Chlamydia is the most frequently reported infectious disease in the US, many of which are asymptomatic infections, which is why screening is so important. So make sure you visit your healthcare provider and have your doctor set up a reflect or a light screen, maybe even a aurora veil to get properly screened. Chlamydia can often be asymptomatic but does really good DPS over time, if not healed off with potions or antidotes. Chlamydia can be baton passed between people if you are within the AoE of infected semen or vaginal fluid, or get either of them in your eye. However, you won't get chlamydia through kissing, hugging, sharing towels, or sharing toilet scene frame data. You can baton pass chlamydia via sex toys, which is quite overpowered. The only way to counteract this is to have a Saradomin mage with 99 magic to enchant your dildo with a holy blessing to prevent infection, or to wrap your Pussy Pounder Extreme Vibration 5000 with a condom. This was found out by pros of the sexually transmitted diseases esports scene, so we may see some changes down the road as we learn more about STD frame data. Chlamydia is definitely one of the most overpowered STDs in our current meta. I'm going to go ahead and put chlamydia into the A tier. Gonorrhea, aka the clap, is an infection caused by sexually transmitted bacterium. Gonorrhea has a very large AoE that infects both females and males, with extremely good RNG in the urethra, rectum, throat, and also cervix. Just like the triple threat of the 3 legendary birds in Pokemon, Zapdos, Articuno, and Moltres, gonorrhea is also a triple threat, which can spread via vaginal, oral, or anal sex. Gonorrhea's DPS is frightening, and it has good RNG in infected mothers, which can be baton passed from mother to baby. For men, gonorrhea increases your pain stat, alters your discharge frame data to be more pus-like, and gives you more EVs and IVs in one of your testicles, causing it to swell. For women, gonorrhea gives you a frame 4 vaginal discharge and a frame 5 painful urination, which are very good non-punishable options. Gonorrhea is B tier. Genital herpes is an STI caused by the herpes simplex virus. This is the first STD that has no cure, which is not surprising given its substats. The herpes simplex virus is a residual damage dealer that likes to stay dormant in the body and can reactivate several times a year. Genital herpes causes residual pain, itching, and sores in your genital area. There are no true counters to genital herpes, making it one of the most oppressive STDs in our current meta. However, medications can ease symptoms and reduce the risk of sharing your poisonous mana with 2 other people. The best counter for genital herpes seems to be condom use. The symptom scale level is not too high in this STD and is often asymptomatic or mild. Although when you do experience symptoms, they are true combos of pain or itching, small red bumps, or tiny white blisters, ulcers, or scabs. Genital herpes likes to stay in the shadows, which is why many professionals in the esports STD arena don't like genital herpes. I'm going to go ahead and put genital herpes in the A tier. Next up is hepatitis. Hepatitis has 3 echophyters within it, making it one of the most versatile STD builds. There's hepatitis A, hepatitis B, and hep C. Hep A is caused by the virus that infects liver cells and causes inflammation. The most common way hep A is spread is through eating or drinking something contaminated with fecal matter, although it can be baton passed through sex with someone who has the virus. The second echophyter, hepatitis B, is a vaccine-preventable liver infection caused by HBV, the hepatitis B virus. Hepatitis B has a large AOE and long-term DPS, meaning the infection is chronic. Hep B has very good frame data, increasing your risk of developing liver failure, liver cancer, or cirrhosis. Hep B can be hard countered by vaccines. However, once you get frame trapped by Hep B, there is no cure. Hep B focuses on stat reduction and buffs to abdominal pain. Hep B focuses on stat reduction and buffs to abdominal pain, dark urine, fever, nausea, vomiting, and jaundice. The third echophyter is hepatitis C, which is a viral infection that causes liver inflammation, sometimes leading to severe, serious liver damage. Chronic hep C is curable and is hard countered by oral medication taken every day for 2 to 6 months. Hep C is another one of those silent DPS types that likes to do small residual damage over time, which is advantageous because people with hep C are often asymptomatic and have no idea that they are infected. Hepatitis S tier. Acquired immunodeficiency syndrome, AIDS, is a long-term DPS, life-threatening monodepleting condition caused by the human immunodeficiency virus, HIV. By reducing your immune system stats, HIV makes you extremely vulnerable by doing massive amounts of shield damage, so you cannot protect yourself against infection and disease. HIV is an STI that can be baton passed from mother to child during pregnancy, childbirth, or breastfeeding. There is no hard counter to HIV or AIDS, and unfortunately there's no cure, but medications can dramatically slow the progression of the disease. The primary infection or acute HIV works by stat reduction and buffs to fever, headache, muscle aches, joint pain, rash, diarrhea, cough, and night sweats. The symptomatic HIV infection can lead to similar buffs, but also includes oral yeast infection, swollen lymph nodes, shingles, and pneumonia. HIV has a very large AOE and good RNG and transference. Infection can occur through vaginal, anal, or oral sex of infected partners, through blood, semen, or vaginal secretions. If you think you may have been infected with HIV or are at risk of contracting the virus, you should tech chase in a doctor's appointment as soon as possible. HIV is definitely one of the most overpowered STDs in our current meta. S tier. Human papillomavirus, or HPV, is a viral infection that does DPS to the skin or mucous membranes, causing warts. HPV is not a one-trick pony. There are more than 100 varieties of HPV. Some HPV infections causes warts. Some HPV infections cause warts, while others can cause different types of cancer. Some types of genital HPV can cause cancer at the lower part of the uterus that connects to the vagina, the cervix. Other types of cancer, including cancers of the anus, penis, vajay, vulva, and back of the throat, or pharyngeal cancer, have been linked to HPV infection. Human papillomavirus is most commonly baton passed via sex or through other skin-to-skin contact. Current hard counters to the strains of HPV most likely to cause genital warts or cervical cancer are vaccines. Wart debuffs of HPV include genital warts, common warts, plantar warts, and flat warts. One of the most overpowered things about HPV is the hitbox of the wart. The warts are contagious and can spread through direct contact, with the wart even spreading when someone touches something that has already touched a wart. Human papillomavirus, B tier. Pelvic inflammatory disease, PID, is an infection of the female reproductive organs. It character swaps via sexually transmitted bacteria and has large AOE spreading over the vagina, uterus, fallopian tubes, and ovaries. Symptom debuffs of pelvic inflammatory disease are often mild and difficult to recognize. Even with a foresight or a lock-on, it's still hard to ascertain whether you have any symptoms. Debuffs include pain in lower abdomen and pelvis, abnormal or heavy vaginal discharge that may have garbodor-like unpleasant odor, abnormal uterine bleeding, especially during or after intercourse or between menstrual cycles, pain during intercourse, fever, or painful urination. Tech trace an appointment with your doctor if you have lower abdominal pain, fever, foul vaginal discharge, or nausea and vomiting. RNG risks that may increase pelvic inflammatory disease AOE include having sex without a condom and douching regularly, which may upset the balance between good versus harmful bacteria in the vagina and may mask symptoms. Pelvic inflammatory disease, B tier. Pubic lice, aka crabs, are tiny insects found in your genital area. These tiny crustacean-like insects measure around 1/16 of an inch or less and does DPS by sucking blood. The most common way to get pubic lice is through sexual activity, although it can be data transferred via sharing clothing, bed sheets, or towels with an infected person. Crab bites can cause severe itching, and one of the hard counters to this are over-the-counter creams and lotions that kill the crabs and their eggs. Debuffs include symptoms of itching in the genital region and can also spread to the armpits, chest, legs, beard or mustache, eyebrows, or eyelashes. Tech trace a medical appointment if over-the-counter products don't kill the lice, if you're pregnant, or you have any infected skin abrasions from scratching. Crabs, B tier. Syphilis is a bacterial infection spread via sexual contact. This disease does small amounts of DPS at first, starting as a painless sore, typically on the genitals, rectum, or mouth. Syphilis can baton pass from person to person via skin contact or mucous membrane contact with these sores. Syphilis can remain dormant for decades and just collect mana before becoming active again. Early syphilis is hard countered by shots of penicillin. Syphilis is one of the most dangerous STDs in our current meta, and when left untreated can severely damage the brain, the heart, and other organs. It can also character swap between mothers and unborn children. Syphilis does DPS in 4 stages. Primary syphilis, which is characterized by a small sore called a chancre, usually healing within 3 to 6 weeks. Secondary syphilis, which is characterized by a rash beginning in the trunk, but eventually spreading a large AOE covering your entire body, often including hair loss, muscle aches, swollen lymph nodes, and sore throat. Latent syphilis, the third stage where you are asymptomatic. This stage can last for years. And tertiary syphilis, which is the final stage, where about 15 to 30% of people who don't get treatment for syphilis will develop brain damage, nerve damage, damage to eyes, heart, blood vessels, liver, bones, and joints. There is some additional DLC syphilis, including neurosyphilis, where the syphilis spreads to the nervous system, and congenital syphilis, where babies being born to women with syphilis can become infected through the placenta or during birth. Syphilis is one of the most broken STDs in our current meta, S tier. Trichomoniasis is a common STI caused by a parasite. In woman builds, trichomoniasis can cause a frame 4 foul-smelling vaginal discharge, frame 2 vaginal itching, and frame 6 painful urination. Men who have trichomoniasis typically don't have symptoms and don't see any stat debuffs, but if they do, they may have buffs to irritation inside the penis, burning with urination or after ejaculation, and discharge from the penis. Trichomoniasis is the most common curable STD and is hard countered by prescription antibiotics. Trichomoniasis, C tier. Shankroid is a bacterial sexually transmitted disease caused by infection of Haemophilus ducreyi. Shankroid has insane DPS characterized by painful, necrotizing genital ulcers. It also may include inguinal lymphadenopathy. This STD has tremendous AOE and is highly contagious, but curable. Shankroid is hard countered by azithromycin and ceftriaxone. You can typically remove ulcer status within 3 to 7 days after therapy. Large ulcers that inflict more damage dealing status may require 2 weeks of healing. This STD has seen more prevalence in the past and overpowered the STD meta, but has since calmed down after awareness and disease prevention improved. Shankroid works by initiating the following debuffs: swollen, painful lymph glands, or inguinal buboes. It is transmitted through sexual transmission via skin-to-skin contact. If left uncountered and untreated, Shankroid may do enough shield damage to shield poke into transmission of HIV. Shankroid, B tier. This is the STD tier list.